bio probably should just say, Renee Branch Canady is passionate about relationships. She is that little girl that never learned how to play by herself. She fights racism because it damages relationships. So, in a nutshell, that's really who I am. And I just want to share some of my thoughts, learning, both academic learning, experiential learning, and when Jen said this was a leadership meeting, then I might count me in, because that is my new passion, trying to push leaders to lead and to be courageous leaders. I just watched the Renee Brown's latest TED Talk with my sons. I have 3 adult sons. And this is their last week in my house. They're all getting like jobs at the same time, right? Do I cry? Do I cheer? What do I do? So one's moving to Indiana, one's moving to the Best Maryland, and one's moving to Houston. So nice places to visit. So let's just dive in. Jen, be my timekeeper. I did just finish a 15-week course on this, so I can go on and on and on, but I want to start out reading a story to you guys. Just get it pulled up. This story is called A Durban Morning. The sun is low on the horizon on a lush and brilliant South African morning. The hills in the distance shimmer with 100 shades of green. On a dirt footpath, paralleling a dusty rural road outside of Durban, 2 men approach each other from opposite directions. Their history could be the history of men and women meeting on dusty roads anywhere in the world. Each man brings a tribal heritage or a past that includes at least one violent chapter. Today, as they near the point of intersection, each one is aware of the past difficulties between their tribes, and there is an instance of anxiety. The moment passes quickly, replaced by something much larger. As the men pause for a moment of greeting, the harsh history of the conflict between their clans and the more recent and equally harsh shared memories of apartheid become simply background for their wide smiles and their heartfelt salutation. Sawubona, says the first. I see you. Sikona, replies the second. I am here. And with this simple exchange, they bring each other into existence, for it is their belief that a person is a person only through human connection, through recognition one of another. So we are living right now in a time where we are tempted to not see each other, either because the hurts are just so deep, or the work needed to authentically see each other is such a heavy lift. And I'm here to challenge you that in moments of discomfort and pain is where the greatest victories can come. And we could have all been born, 50 years ago and had the work of Martin Luther King and all those others, but we're not. We're here in this place where the temptation is to say, well, good enough is good enough. Or we do the second level of lifting so that things really are better off in this nation. And I've lived, my entire life in this nation, except for 3 years in the Philippines as the child of a military man. But always about the belief of what we said we were as a nation. And so we're going to just talk a little bit, I think, about some strategies and how we get there. And I love that when I was looking for a graphic for that story, that the quote came up in Spanish. So it's like this universal thing, right? This is the Sawubona. Yo te respeto, yo te valoro, y tú eres importante para mí. Y Sikoba, entonces, yo existe para ti. I see you, then I exist. We've spent too much time ignoring people, particularly people that have experienced the loss and pain of sexual violence. I, with both shame and pride, speak to my connection with Michigan State University, where we're trying to turn a history, right, of ignoring some reprehensible harm to many young ladies. I was telling Jen that it just so happened last week, I got an email from the director of our MPH program where I teach, and he was like, hey, you're lapsed. I got an email that your Title IX training is lapsed. I don't want to be on that list. So it was a good refresh to think about the purpose of your work and why it's still yet so important. So we're going to talk first about partnering authentically, and we're going to talk about partnering intentionally, and then I'm going to kind of lay down a leadership gauntlet for you, and then hopefully just have tilled the soil for your thinking for this next day and a half. So partnering in community, it's this challenging thing, right? I'm a sociologist by training, so I am passionate about groups and social interactions, but this idea of community, particularly in health and prevention and public health, has often come with a lot of unanticipated negative consequences. And by the way, these slides are going to be made available to you at the end of the conference. So just a couple of things I want you to think about. Too often, community is viewed as othering, right? Not intentionally, but we always, somehow or another, don't see ourselves as part of the community. It's always about like those people. So I just sometimes figure out, do we just drive off into the sunset and we don't go live somewhere? Like, we are community, and the more in touch we are with our own communities, the more we can embrace communities that we get exposed to because of the privilege and the work that we're honored to do. So being cautious about community is othering. Also, community is problematizing, right? 9 times out of 10 in public health and prevention, we're reaching out to community because they're doing something wrong, right? There's something that we just gotta fix, and aren't you lucky that we're the technical assistance team to come in like the cavalry and fix things for you. So othering, problematizing, and then just not including people in decisions. And my colleague at the University of Maryland said that he was doing community work, and the community said to him, we will partner with you on one condition, that there's no decisions about us without us. And that has been such a powerful mantra for me. I use it as a leader in my organization. I'm telling my managers all the time, what does the team think? Do you really want us to talk to them about every decision? Yeah, pretty much. If it's gonna affect their life, if you're making a decision that's not gonna affect them, then don't worry about it. But what does that look like? To drive, I mean, it takes more time, right? It's much easier as a leader to just make a decision. After all, we're leaders because we're experienced and we're educated and we're knowledgeable. Yeah, no decisions about us without us. So I've been pushing my team, and even in my own thinking, about what is community in terms of resilience, not problematizing it. When I first started my research career at Michigan State University, I was doing research on infant mortality and the pregnancy experiences of Black mothers and white mothers. And if I had stayed at Michigan State, I decided I would probably have stopped studying why are so many Black babies dying, and start studying, well, how are any Black babies surviving? Like, what are the replicable things? Instead of telling communities, don't do that, that's bad, you shouldn't do that. What are the lessons that we're learning that we're pushing people to replicate and say, you know what, try this. This worked in Indiana, try this. This was really successful in Houston. They have some similar experiences as yours, try this. So how do we see community as resilience? How do we see community as solidarity? It's really kind of a struggle for us when we're trying to drive an intervention and the community in numbers rises up and say, not so much. We don't want to do that. When we were doing our health assessment when I was leading our health department, and we kind of in our mind had sort of done this sort of like ad hoc hypotheses, like I'm sure it's gonna all lead to obesity, and we're gonna focus on that. And it did lead to obesity, and the community said, well, that's all very interesting, but we're very concerned about safety and crime. That's what we want the priority to be. Well, we don't really have the evidence to demonstrate that. Well, let me tell you what the evidence is. I walk my kid to school on the inside, very worried about whether or not they're going to get there safely. That's the evidence. So how do we begin to see the power of solidarity in the community and then using that to inform how we are both applying our evidence-based practices and our evidence-informed practices. The other is community as power. Sometimes people don't want to acknowledge that they're leaders because they're uncomfortable with power. And we're going to talk a little bit more about power. So partnering in community, we do a lot of partnering in community, but not always partnering with community. So I would submit a couple of frames for you to think about. One, that community is less defined by radius and more defined by relationship. You guys are a community because you're all in relationship, and it had nothing to do about the square mileage around the downtown Philly hotel, except for our colleague that drove over the bridge. It was all about you. This is true. Community as defined by values as opposed to locale or location. How do we, with all due respect to my medical geographer colleagues and my demographers, how do we expand that frame? And then community that is defined more about our affinities. And we're talking more and more about affinities. We're in the process of doing some affinity work at my institute to just try to bring together the voices of folk that have a shared experience. So we're doing an LGBTQ affinity group for staff. We're doing a people of color affinity group at our staff to just say, what is your lived experience like here at MPHI? And how can we strengthen or improve that? What are we overlooking? So let's go back to that awkward thing called power. Understanding the power of relationship, but also understanding the relationships of power. Communities are powerful. Anybody have community organizing background? So we're in the process of managing a couple of projects for the Centers for Disease Control, actually in the Division of Violence Prevention also, that looks at partnering organizers with public health professionals to figure out what are the benefits of bringing together these two very strong disciplines. And so thinking about what power looks like and embracing the appropriate use of power as opposed to condemning and running from inappropriate uses of power. So let me just throw out a couple of points for you to think about. Power is pretty simply just the ability to make something happen. So there are some spaces where I feel very, very powerful, and there are other spaces where I don't feel as powerful. It has nothing to do with the position that you hold. There's a type of hierarchical power, but I know a lot of CEOs that can't make squat happen, honestly. They're not tied into their power or their ability to make something happen. So we tend to say power is bad. Power is actually a neutral phenomena. These are lessons that I've learned from that project with our organizing colleagues. It is simply the ability to affect change. How do we build power? Power is really a consequence of relationships. So when you think about these cross-sector things that you're doing, your communities, your organizations, the other stakeholders, that should really be about how do we align our power to make change happen? What is our shared goal? So both one-on-ones, interacting and talking with people, taking them to lunch, going to coffee, meeting up, and sometimes we think, oh, it's just about getting to know that person, but what good is getting to know that person if you don't understand what motivates them, what drives them, and how you can help them, their self-interest get advanced even as yours are. Leadership development, I found that organizers refer to what I was calling volunteers as leaders. A number of organizers that do their work in faith-based organizing, so they're organizing through congregations, those are their leaders. And then, as Jen was saying, like they're the technical assistance people that are just facilitating what the needs are. So more people, more power. And then the win in the mind of organizers is really about, have we gotten a positive change, concrete changes in people's lives? And I would submit that in public health and in prevention, for too long, we've just been comfortable with the doing of the work and not really focused on the outcomes. We say we're focused on outcomes, but we're not really. I have been in the infant mortality battle for 25 years, and the numbers just are not improving. Black babies are still 2 to 4 times more likely to die than before their first birthday than white babies. I could stay employed for another 25 more years because we have not been really pushing toward positive change. And there now is this groundswell where people are like, okay, we have to really think about what are we doing and how are we going to do it differently. The goal, and when you're in prevention, the goal is to kind of work ourselves out of a job, right? We want sexual assault and relationship violence to be so nominal. Now, we don't want to lose vigilance, because sometimes public health will have some wins, and then we change our attention, and then the numbers go back up. We see that now with syphilis numbers. We see that now with the measles outbreak. So you do have to stay vigilant in a space, but the goal is to not have to have such a heavy lift as we've had, right? So partnering authentically can't happen without partnering intentionally. And so I want to just share with you some some vocabulary, right? And these terms are definitions that we constructed with our community. Because if you Google and Google Scholar and search engine, however you want to these terms, you're going to find a gazillion definitions. You have to find the one that fits for you, your organization, your priorities, your relationships, your community's priorities. And so these are ones that when we were doing the work and really developing our model of health equity, felt comfortable for us in Ingham County. So I encourage you to think through a process. As a matter of fact, in my class, I have a group assignment with my students where they have to do a consensus definition. And they have several terms, and they, as a group, have to look up different definitions and figure out why and explain why they choose the definition that they choose. So social justice is the absence of unfair, unjust advantage of privilege based on race, class, gender, and other forms of difference. My community was like, yeah, we don't want to necessarily start out focusing on the goal. We want to focus on the muck and the mire that we're in right now so that we can get to the goal. So some people felt some kind of way about that definition, but I want you to see that it is based in relationship and in community. And then once you have your definition, stand with it. So I was, I forgot where I was, and someone asked me a question and sort of used derogatorily the term social justice warriors. Well, you social justice warriors are. I was like, yes, we are. Because you know why? Racism, classism, gender discrimination are worth fighting about. I'm not really a fighter, but there are some things that I'm going to dig my heels in, and I'm going to stand firm. And injustice in a nation that says we hold these truths to be self-evident, on and on and on, yeah, I'm going to war for that. So sometimes building a vocabulary is what helps keep the work advancing. Because we let things shut us down. Okay. No, it's all right. Stand up. We have been thinking about the work, and I encourage you to think about this in your prevention strategies. There are 4 levels of oppression, but as I said, with us trying to think from a resilience space. These are also levels of change. It's exactly where change happens. So these are just socio-ecological models. It's nothing complicated, right? The personal level, the interpersonal level, the institutional, the cultural, some people want to say structural, whatever, again, is comfortable for you. These are where my community landed. But personal meaning, what are our feelings and what are our beliefs, what are our values in this space, me, in my brain and in my heart. What do I think and feel about this? Interpersonal is then how do my thoughts and feelings and my knowledge then push me towards some action. So what is the behavior? What is the language that I'm using? Institutional are those rules and policies and procedures. And cultural are those things, kind of those values. Like what are those collective ideas about what's right, what's beautiful, what's normal. And when I first got to County, we were doing a lot of work at the institution. And I was like a policy sleuth. Like we are gonna find those bad policies and we are going to correct them, we're gonna update them, we're gonna change them. And we kept going policy through policy through policy. And when you read the words on the paper, I'm like, well, I'm just not finding anything wrong with these words on this paper. And then we had the epiphany. The issue is not the words on the paper, it's how they're being executed, which then took us back to the personal and the interpersonal. Like, okay, so we gotta do this. We gotta make sure the words on the paper are saying the right things. We also gotta make sure the team has done enough of their own work that they can execute in an accurate and an appropriate way. So the thing that we tried to, one thing that I just want to throw out to you too is, if you have an institutional, the solutions align with the source of the problem. So if you have a interpersonal problem, the solution isn't necessarily to go create some huge policy for this one person, right? Or vice versa. If you've got an institutional issue, training all your staff, the people, is not going to fix an institutional norm. So you've got to align those problems and think about when you get faced with a challenge in your community, in your partnerships, figure out, okay, this thing happened. Was this a personal, interpersonal issue, or was this an institutional issue that continues to happen? We see institutional structural patterns throughout this nation. So I could go to any urban core in the nation, and you're going to see the same kind of things, right? You're going to see the underdeveloped, undervalued neighborhoods. You're going to see lots of alcohol, beverage stores. You're going to see most communities have some clear geographic barriers. The wrong side of the railroad tracks was a real thing. In some communities it was a river. In some communities it was a highway that came and plowed through communities. You see these same things over and over and over again. If you're on Martin Luther King Drive, Street, Boulevard, you are probably in the wrong side, right, of town. Rarely do you see these things not fit. Now, I've seen some exceptions, I'm hoping to see more exceptions, but this whole institutional pattern, right? So just begin to kind of deconstruct the problems you're trying to fix, maybe through this lens. So let me give you a couple of other vocabulary terms, again, a shared vocabulary. Because you gotta mean what you say what you mean. So everybody right now is saying health equity, and everybody's saying health inequity. But may I tell you that everybody's saying health equity and health inequity don't really mean health equity and health inequity. A lot of them just mean social determinants of health, and they're not the same thing. So health inequity, I absolutely love this definition by Margaret Whitehead. And she says that health inequity is the differences in population and health status and mortality rates that are systemic, they are patterned, they are unfair, they are unjust, and they are actionable, as opposed to random or caused by people that experience the illness or experience the event. I love that Margaret White had brought values to the table, right? She's like, listen, this is unfair and it's unjust. Because we were sort of taught and socialized as professionals, you know, that you're supposed to be unbiased and don't talk about values, don't talk about, you know, politics and religion and all these things, right, that are value driven. But we have continued to just sort of blame the people that experienced the event. Well, I don't know, those girls should have known not to walk from class to their dorm when it was late. They should have known to get a group of girls when I was in school. Don't walk by the bell tower. I mean, you did whoop-whoop for Michigan State, but whoop-whoop for UNC, which is my undergrad. I went to school with Michael Jordan, my claim to fame. You can get my autograph afterwards. But why, you know, why is it that we want to blame, you guys have to see this all the time, right, in your work. We're going to blame those that experience the offense instead of thinking about what are we doing to set up the offense in the very beginning. So it's systemic. Like I said, these communities all look alike. You guys are from all over the nation managing the same types of problems. So there's a pattern to them. And we have to just decide that it's unfair. This is not acceptable. And we're going to stand up and do something about it. Health equity. We would submit, and this was a definition that Paula Braidman put together. She's a professor at UCSF, and I was really pleased that she reached out and asked me to be on a committee to help her think through this definition. Yes, health equity means that we all have a fair and just opportunity for good health. It is not complicated. So when people say, well, what do we mean by health equity? It just means that we all have a fair and a just opportunity for good health. All of us, regardless of where we live, regardless of our age, regardless of our race, regardless of our sexual orientation, we all have the same fair, just opportunity. Not the same opportunity, but the same fair and just. You're getting what you need, I'm getting what I need, they're getting what they're needing. So she says, health equity, I love this, almost as much as I love the Margaret White, because she did the same kind of thing. So health equity is the ethical and human rights principle or value that motivates us to eliminate disparities. Particularly in research, we describe disparities and we just like, oh, found another one. Oh, I want to tell NIH, don't fund any more disparity studies, please. We know that the poor people, the brown people, the female people, they're all going to be bad. But you can't talk about health equity without talking about institutional racism, class oppression, and gender discrimination. There is no way we can talk about the same. So Paula says, in order to make sure that we all have a fair and just opportunity for good health, this requires removing obstacles to health, such as poverty, discrimination, and their consequences, including powerlessness, lack of access to good jobs with fair pay, quality education, housing, safe environment, health care. So we're not just dealing with social determinants of health for the sake of social determinants of health. We're dealing with social determinants of health because we're deconstructing racism, classism, and gender oppression. And we've got to get comfortable understanding that those are the root causes. Social determinants of health is midstream at best. It's not upstream work. And I know we're all, I think when we become leaders, I'm from from Michigan, so Wayne Gretzky used to say, you gotta skate to where the puck is going. So that's our job as leaders. This is about us eliminating these root causes so that poverty does change, so that classism does change. Because otherwise people are like, fix racism? Then who can do that? Fix poverty? Who can do that? Well, we can. I can't do it by myself. You can't do it by yourself. Your state might not even be able to do it by yourself. But with a shared vision and advancing change together, we can. We got here, we didn't get here overnight, but we know that we can do it. So keeping sort of hold to this being sort of a moral factor that drives us to address disparities. If you're doing the work in a way that you feel really comfortable, I suggest you're not doing the work. So we got to keep pushing through discomfort, and I'm going to keep slamming you with the blocks, right? The 3 basic food groups. So when we're doing this work, these are kind of like the 4 cards that I always try to have in my back pocket. We, part of our sort of national work has been around helping people advance dialogue in this space in an authentic way that moves change. So if you feel like we're just really tired of talking about this, then I would suggest, yes, why don't you stop talking about it and have a dialogue that is driving action. So the 4 things that I find stop dialogue quicker than the other is the fact that we are sort of socialized in this space. And again, I'm assuming anybody grew up outside of the United States? 1 person. So this may not fully relate to what country? What country? Puerto Rico. Okay, well, kind of cousins. If we could remember that as a nation, right? So intent versus impact. So in this country, we want to say if we didn't mean to offend you, then we didn't offend you. Well, I didn't mean to offend you. Okay, but you did. So we are responsible for the impact of our actions. If I am walking by with my lovely Clark wedges and I step on Jen's toe accidentally, the fact that I didn't mean to step on her toe does not keep her toe from hurting. So I should get a chair, put your foot up, and go get some ice. What can I do? It's my responsibility to deal with the impact. And so we just don't want to do this one, I didn't mean to. We don't even want to say, I'm sorry, authentically, right? What do we say? I'm sorry if. No, we are having this debate and my face is red because you did. So instead of saying, I'm sorry that, take responsibility. So intent versus impact. And we've all sort of been socialized into this milieu, right? The other is both and thinking, because we are taught either or thinking. Either it's this or it's that. And in dialogue, we would submit that both truths have to rest in a room, and then we wade our way through that. That's what keeps dialogue going, because we try to convince you that this is the truth, because it's either this or it's that. This is a sidebar, but when I was in undergrad, I was in a biology lab and we were doing blood typing. And my lab partner was a young white girl from a pretty rural community in North Carolina. And so we finished typing and I said, what's your blood type? She said, well, what's your blood type? I said, B positive. And she said, oh, you must have done that wrong. No, actually I knew I was B positive because my dad is B positive and my mother is O negative, so like me and my brothers better all be B positive. And she's just getting really animated about it. She's like, I don't know about that, but you had to have done it wrong. So the lab team comes over and like, what's the problem? And she's like, she did hers wrong, but she won't admit it. And like, why do you think she did it wrong? Because she's B positive and I'm B positive. Okay. Well, black and white people don't have the same blood types. Now, I'm not that old, right? If it's in my lifetime, if we're still telling these stories, we still have not done the work. So that's like, well, it's either got to be this or it's got to be that. Both and thinking. Your lived experience is true and legitimized. My lived experience is true and legitimized. Let's understand where those things reconcile and where those things repel, and that's okay. So keep the dialogue going. And I said this before, that if you're doing the work in a way that seems really comfortable, you are not doing the work that is needed to affect the change and bring prevention to bear at this time. There's just too much stuff happening in our nation, and nobody wants to talk about it because it's uncomfortable. But we've got to just be the ones to stand up because we're leaders. The other thing that I would throw out that keeps dialogues on racism and prevention from happening is this context of incidental versus contextual. So when a racist event happens for people of color or communities that are exposed to these events regularly, it's like a context. It's like one more time, this person is gonna pretend like I wasn't standing at this counter and go ask the other person again. But for people that don't experience racialized events, it seems like an incident. So when you're the white person being helped, oh, no, she was next. Wow, that was really racist, but that was an incident. For this person of color, it's a context. Here we go again. And so the white person's like, why are you so upset? Like, I told her you were next in line. Because you don't know what I've been living for. This is the third time this has happened in the last 2 days, or whatever it is. So context versus incident. That's why we've got to have both ends thinking. That's why we have to be intentional, not just impactful. Okay? So your 4 cards in the back of your pocket. Right? I'm trying to get you ready to go back and do work, as they say. And I'm going to get you one more time. Because the things that prevent us from doing this are that history, that unresolved history. So we talk a lot, right, about this health equity lens, that's the health equity framework. Not real sure what that means. So I want to suggest that if we're applying a health equity framework, we are doing differently. How am I doing? Okay. We're doing differently, we're seeing differently, and we're saying differently. Let me just walk you through some of those things. So we, in our community, said, all right, we picked these definitions together. And if these are the definitions that we're comfortable with, what do those definitions look like in action? And so this is what we constructed. So a health equity lens, because of how we define health equity and social justice, will seek out what's unfair in order to reverse it or avoid it. Remember, we're talking about intentionality in relationship. Seeking it out. We're making the assumption, you know what, something unfair is happening. It's gotta be, because we're all products of our environment, we're all products of this era of our nation, we're all products of having not dealt with the consequences of slavery. And I mean, can you think about, many of our grandmothers in this group couldn't vote. And what we did was just change laws and said, okay, y'all can play together now. Even in South Africa, acknowledgement to the Durban Morning, they put together this Truth and Reconciliation Commission, which was a federal effort, right, to bring people together. We didn't do that. We took down the signs, colors only, whites only, took down the signs, and then said, y'all like each other. So we just have unresolved issues. But I don't believe they're irreconcilable, right? I don't think we have to go through divorce court for this. We just have to get some therapy. Right? So we're seeking out what's unfair in order to reverse it, in order to avoid it. No, because remember the last time that thing happened and this part of the community felt like we othered and problematized them. Let's try this strategy. No, I see what they're saying in the technical package. We applied that really poorly because of XYZ. So be intentional, seek it out. Not only are we seeking it out, but we're aspiring to apply justice. Like, what would justice look like when we're serving individuals, when we're serving communities? What would that fairness and rightness look like? Health equity lens recognizes that social resources in the interventions that we're providing in the care and behavior, that those make a difference. It's not just about opening up a clinic somewhere or setting up a hotline, because people use things differently based upon the social context of their lives. And then lastly, we said that using a health equity lens, seeing things different, we would identify, not just identify, but it was our job to facilitate the social opportunities needed for individuals, for communities to attain well-being easily. Because right now, the healthy choice is not the easy choice. One of my son that's moving to Bethesda is my youngest son, and his last year in college, he said, I'm about to be a real adult mom. I need to start eating better. I said, okay, son, eat better. So after about 2 weeks, he called me. He's like, Mom, I'm gonna need more money to eat better. This stuff is expensive. The healthy choice is not the easy choice in this nation. So as you're setting up your interventions and you're working with communities, you're thinking about, it's my responsibility. It's not just like, oh, I found it, I'm gonna tell you what to do. No, it's my job, I found it, let me work with you on how can I help facilitate that for you. There's a lot of talk right now about implicit bias, unconscious bias. How many of y'all been to an implicit bias workshop? So we need to keep having that conversation. It is both and, right? It's not either or. But in 2016, the American Red Cross, and I hope you can see this, put out a water safety poster. Good. Water safety is important. Drowning is a bad thing. So it's like, be cool, follow the rules. But somehow or another, unconsciously, implicitly, all of the cool behavior just happened to be white folk with cool behavior, and all of the bad behavior just happened to be brown people. So the walking with a glass bottle, the running, the pushing people off, the jumping off the board, all of that, wow, isn't that interesting that it was only brown people doing bad stuff, but the playing nicely with your kid in the pool, and the waiting your turn on the board, all of it's socialized, it is baked in. If we are not intentional, not to their credit, somebody called them on it and they pulled it down. But you know, stuff lives on the internet forever, so. We are a part of, we're all products of that environment, right? So seeing differently, that's where that intentionality comes from. Saying differently. There's a lot of, now another kind of push and wave on narrative, changing the narrative, right? Again, being authentic, and what does that mean? I've been a public health professional in total 30 years now, and I've rode the way from sort of workforce diversity to cultural competence to cultural humility to health disparities to health equity to health. It's all the same dialogue with a different label. So if people are more comfortable saying whatever they're comfortable saying, I'm like, yes, and, right? Both activities. I was doing a cultural competence talk, and we do talks in the academy, and we're just all so smart, and people want to let you know how smart they are. So I did my cultural competence talk, and a valued colleague said, well, I actually think there's more legitimacy to the term cultural humility. You don't seem very comfortable saying that to me, but okay. Thoughts in my brain. Don't say that, say this. Yes, cultural humility and cultural competence. Both of those things drive us to a space. Because again, it's about dialogue. How are you going to keep the dialogue happening? How are you going to keep us open at the personal, interpersonal space so we can construct better interventions, we can construct better policies, we can change institutions, and we can shift our culture. So, health equity leadership, I say, is framed not by having all the answers. Don't take that burden. Like when we do our facilitator workshops and we train trainers to facilitate health equity, 9 times out of 10, at the end of all this technical assistance and training, they say, I still don't feel ready to facilitate a dialogue because I feel like I'm not going to have, I don't have the answers. And people are going to ask me questions. I'm like, that means you're ready. If you felt like you had all the answers, then I would say we should do some more work with you. So what are the questions? So I want to just give you an example, particularly in the prevention space, of how we've kind of gotten off kilter on that. We, if you ask the wrong questions, right, you're going to get the wrong answers, and you're going to apply your things based on what's not the pressing need. So let me just give you, I'm going to give you some general public health questions, and then we're going to think through some questions in your space. So instead of only asking, why do people smoke? It's an important public health prevention questions. Smoking cessation, tons of literature, now getting into vaping, all kinds of things. But instead of only asking why people smoke, perhaps we should also ask, what are the social conditions and economic policies that predispose people to the stress that encourages smoking? Do you see the levels? Personal, interpersonal, institutional, structural. Instead of just asking who lacks health care coverage and why, and I have loved, when Affordable Care Act was passed, I started to take that one off. But I'm glad I've left it on because we see the wave, right, of what happens based on policy change. But instead of only asking that, we should probably also ask, what are the policy changes that would redistribute healthcare resources more equitably across our community? Not equally, equitably. Give them what they need, give me what I need. Again, we're socialized, I put that back on my other slide, that fairness is sameness. And sometimes the most unfair thing you can do is to treat people the same. People don't need the same things, but that's how we're socialized. So another question, how do we connect isolated individuals, moms to social support? Whole bunch of social support literature. Maybe we should also say, what are the institutional policies and practices that maintain rather than, they counteract people's isolation? We have a ton, if you know anything about laws, what's her name? Michelle Alexander, who wrote the new Jim Crow, and she talks about how formerly incarcerated people really get treated the same way we treated blacks under Jim Crow. So if you have a family whose, I'll say father in this case, goes away to jail for a felony, you're left with a mom, probably underemployed, and kids, and it's not unsurprising that they end up living in public housing. Well, when dad gets released, because he has a felony, he is not eligible to live in public housing. So basically, we are assuring the continued financial, emotional isolation of that family from an important support person. It's a practice, it's a policy that people just said, we're gonna keep blaming them and punishing them for the rest of their life. Forget that whole I've done my turn kind of thing. But there are policies out there that are having the completely opposite effect that we're trying to have. So let's think about your space. Why don't women just say no? No means no. Just say no. Perhaps we should also ask, what power dynamics undermine the effect of saying no in the face of harassment? We don't want to talk about the fact that women say no all the time, and the outcome is still the same. Why is that? And why is that our responsibility as opposed to just teaching women to do self-defense classes and to say no? Why do some people drink so much? Probably those people where the liquor beverage stores are like right on the corner. Why are they drinking so much? Those Native Americans on reservations where alcoholism rates are sky high. Well, they should just stop drinking so much. Maybe we should also ask, what are the policies and the zoning practices that reinforce the disproportionate presence of alcohol selling outlets in vulnerable communities? This is all. If we only focus on one, we're not going to solve the problem. If we only focus on the other, we're still not going to solve the problem. It is both. Why don't people just get another job if they're being sexually harassed? Okay, your turn. What might be the question that we should also ask? I didn't warn y'all that I was still don't do that. Talk back, faith. Be courageous. Renee Brown would be proud of you. Yeah.
What institutional structures support the tolerance of harassment?
What institutional structures
support a culture
support a culture of intolerance. Yes, that's a good one. Well, yeah, so why don't people get another job if they're being harassed? What structures and policies are reinforcing that culture? Yeah. Another one, let's try one more on that same question. What's another way what's the other question we might ask? Yes?
What employment practices make it challenging for people to seek out new opportunities?
What employment practices make it difficult or challenging for people to seek out new opportunities? Some people are sort of boxed in at their job. They wanted to choose another job, they wouldn't be able to. And what are the employment practices that prevent them from looking or that support them should they remain in their employment? Excellent. So here's the one. Props to Jen and the team, they helped me with this. So here's the other one. What cultural norms maintain rather than counteract the status quo and limit people's ability to act in their best interests when facing harassment? We compromise our well-being all the time in this space, all the time, because there are no structures, because we only see the problem at personal, interpersonal. And then the last one, why don't people just report sexual assault to the police? Well, it's their fault because, that thing happened and they didn't say anything. So it's their fault actually that person after them got assaulted because that person should have reported it. Perhaps we should also ask. Yes?
What cultural norms and systemic issues are there that are preventing them from feeling safe reaching out to law enforcement?
Say again.
So what cultural norms or systemic issues are in place that are preventing people from feeling safe reaching out to law enforcement?
Yes. What cultural norms or systemic practices are preventing people from feeling safe in reaching out? Yes. So we're just thinking more broadly. That's very similar to what I had put up there. What institutional practices maintain a culture that discourages the reporting of sexual harassment by those experiencing it as well as bystanders? I just learned all about the bystander literature. So yes. So do you all see? We're just trying to broaden the dialogue. So let me just throw out a couple more points. So from a leadership perspective in doing differently, the opportunity is for you at the personal, interpersonal, we call this doing your own work. Are you thinking deeply about this? I encourage my staff to bring their whole self to work. We, again, have been socialized that there's our professional self and there's our personal self. That is a myth. Like, we're like one person.
Yeah.
I wish I could just separate from my professional self. Yeah, you go do all the yucky stuff, and I'm just gonna stay home and play cards with my sons. If you're having a bad day at work, it affects your relationships at home. And if you're having a wonderful celebratory thing that just happened at home, you're in a much better space when you get to work. They are the same. So what is your work? If you're in this space, I talk less about the position that you hold and more about the positioning that you've been given. Your position to be a change agent in this space. And if all you see is this is how I get my paycheck, I would invite you to think deeply. Think deeply about what's the next step in your career. Sooner rather than later. Because there are too many people in this room rolling up their sleeves, like trying deeply to make a difference. So do your own work. I'm really uncomfortable with the transgender stuff. I don't know what to think, and I'm so confused. Okay, that's the first start in leveraging and learning. Do some thinking, do some reading, make a friend, talk to somebody, go to lunch with someone, and be transparent. And say, I feel so ignorant in this space. I just want to talk to you. I don't want you to help me do my work. I just want to to build an authentic relationship with someone. Because there's nothing worse, I will say, as a black woman, when a white person comes and wants me to fix their worldview. Not here. Not here for that. Go talk to a white person that's done their work and be more comfortable in that space. So, do your own work. Institutionally and culturally, we just have to be more courageous. I keep talking about that. We really do have to take the risk and be willing to say the uncomfortable thing. So, who are we and what we're doing? I love this quote Martin Luther King says, we're not fooling anybody. You have very little morally persuasive power with people who can feel your underlying contempt. If you're not doing your own work, I used to ask my nursing students, I was on faculty in the College of Nursing for 15 years, and I would ask them, can you be a racist and still practice in a culturally competent way? What do y'all think?
No.
No? Oh no, I know a lot of people that fake it all the time. Both and maybe. In the purest of senses, we want to be able to say, yeah, no, you cannot be a racist and think you're coming off in a culturally competent way. But we do see people that fake it, and that there are excellent actors, and they're not all in Hollywood. Some of them work down the hall from you. They're just pretending. So Martin Luther King is suggesting that you can't, that authenticity wins the day. So I want to just invite y'all to do a little self-assessment and think about this. This is Tom Purnell, who's a nursing researcher, and he talks about consciousness, meaning awareness, and competence, meaning the skill to act and do in this space. And so he says we start out in that top left box in this 2x2 that is the space he calls unconscious incompetence. Like you don't get it and you don't get that you don't get it. It's just like Clueless. It's the person at the Thanksgiving dinner that says whatever and you go, Uncle Jim, what? Just don't get it, right? So I'm assuming no one in this room is in that box, but if you are, just keep looking straight ahead. Don't look down because you're telling yourself. So he says we go from, the goal is to move from unconscious incompetence to move to conscious incompetence. Like we mess it up sometimes, we do get our foot in our mouth, but when our foot's in our mouth, we realize it. And we're just like, shouldn't have said that. So that's a space of growth. The other, then, he says we move to unconscious competence. Like we know we should be doing some things, we get it right sometimes, but we're not really sure what we did when we get it right. So we can't really replicate it. But we know that I should be not saying some things, I shouldn't be saying some things, I should be open to this space. I gave you those 4 cards, but they also, they'll get you, they're like get out of jail free cards, but they also get you in jail sometimes. So unconscious competence, and he says the goal then is to get to conscious competence. Yep, I have a knowledge, I have an understanding, I have awareness, I have a skill set. I would submit, not that Dr. Tom Purnell asked me to adapt his model, but I would throw one more in there, because I want us as a nation and as a profession to get to a space of, I'm just going to call it subconscious competence. Because if you think about when you're, like any of you all lived through your child learning to drive, that's where I really learned to drive. So my son would get in the car, and this is my oldest son, and so I've not done it before, and he's like, put the seatbelt on, fix this, check the outside mirror, check the blind spot, wait a minute, turn the radio down, and in the meantime, I'm like, can we just go? Because he's consciously aware of these things that he needs to do, but he's not created a habit yet. So like we get in the car, we do all those things, But they're just like subconscious. Like we just do that because, yeah, check my blind spot, all of those things. So how do we get so good at this that we're just automatically doing the right thing? So I challenge you to think about where you are as you're on your journey for doing your own work, where you might be. I want to do one last thing on that subconscious bias, and then we're gonna call it a day. Do a couple of questions, and I want you to answer them together and out loud. Okay? As a collective, remember I'm a sociologist. So, they're not trick questions. What color is this paper?
White.
Okay. I'm going to ask you the same question several times, making sure I hear everyone and making sure everyone's confident. What color is this?
White.
White.
What about this one?
White. White.
A couple more to be sure.
White. White.
What do cows drink?
Milk. Water.
Wait. Oh, those kind of questions. Let's do one more.
Yeah.
Some of y'all look like my contemporaries. When I was learning to read, we had a little reading primer called the Dick and Jane series. You might know Dick and Jane. Don't date me. Don't leave me out here by myself. Dick and Jane had a dog named Spot. Yes. So we're going to spell Spot several times, just like the paper, okay? So spell Spot.
S-P-O-T.
Again.
S-P-O-T.
Spell Spot.
S-P-O-T.
Couple more.
S-P-O-T.
Last time.
S-P-O-T.
What do you do with green light?
Oh.
Go. What is required for us to do work authentically in community and intentionally in community? What is required for us to see differently, say differently, and do differently is to have a goal of unlearning many, many things that we've learned and relearning some other things that drive us to a space of equity. So I want you to think about, I'm going to click through these questions, but I want you to think about what stands out for you, right? Just what are the nuggets? It was an hour lecture, whatever I've done, I probably went over time a little bit. What are the things that you're going to grab hold of, and this I can use, and this I can work with? Think about something. Also think about what is going to get in your way in trying to execute on these things, and what power do you have to shift those things. And then really, as a leader, the work you do in your employment ultimately improves this nation. So think about how you're committed there. And I just want to leave you with two quotes. This quote by Antoine de Saint-Exupéry, who's a French aviator. He says, if you want to build a ship, don't drum up people to collect wood, and don't assign them tasks and work. We're really good at that at the committee meeting, right? Who followed up with, don't do that in community with community. Rather, teach them to long for the endless immensity of the sea. Health equity on the horizon is that endless immensity. The reduction and elimination of sexual violence is that endless immensity of the sea. And believe that the passion of who we are will get us there. But don't be naive, because it's hard work, right? It's one of my favorite quotes from the book of Galatians, and the Renee Canady translation says, don't get tired of doing the right thing. Because if we don't roll in the towel, if we don't give up hope, then you will reap, I will reap, our children will reap, and the history books about the United States of America will read very, very differently. Thank y'all.